Good morning. Today we are going to talk about classification of hypovolemic shock. So basically, hypovolemic shock is being classified accordingly depending on the percentage of blood lost. So basically, hypovolemic shock are being classified into 4 classes. Before getting into that, we have to know a normal person with 70 kgs of weight usually has about 5 liter amounts of blood. Alright, so basically, um, the first classification is class 1, usually is known as mild classification. And then we have class 2 or moderate. And then we have class 3 or severe. And then we have class 4 or dying. Alright, percentage of blood loss for class 1 would be less than 15%. Moving on to class 2 or moderate, the percentage of blood loss for class 2 will be 15% to 30%. For class 3, the percentage of blood lost will be 30% to 40%. For class 4, the percentage of blood loss will be more than 40%. And then we moving on to volume of blood loss in milliliter. For class 1, the volume of blood loss will be up to 750 milliliter. For class 2, about 750 milliliter to 1500 milliliter. For class 3, about 1500 milliliter to 2000 milliliter. For class 4 will be more than 2000 milliliter volume of blood loss in milliliter. Alright, so we get into parameters or things that we need to know. So basically, for heart rate, for class 1, usually they have normal heart rate, usually about less than 500 beats per minute. For class 2, usually they are slightly, sometimes they have normal heart rate or sometimes they are slightly tachycardic. Moving on to class 3, usually they are tachycardic, about 120 beats per minute to 140 beats per minute. For class 4, they have the highest heart rate, about more than 140 beats per minute. Then we are going to see the blood pressure for the whole classes. So for class 1, the blood pressure usually would be normal. For class 2, usually sometimes they have normal blood pressure, sometimes they are slightly hypotensive, but usually they are normal. For class 2, usually they are hypotensive. For class 4, there are more hypotension than class 3. And then we're going to see the respiratory rate. Usually for class 1, usually they have normal respiratory rate, about 14 to 20 breaths per minute. For class 2, usually they are slightly tachypneic, about 20 breaths to 30 breaths per minute. For class 3, they are tachypneic. They are more tachypneic than class 2. Usually they have about 30 to 40 breaths per minute. For class 4, usually they are really in tachypneic state, usually more than 40 breaths per minute. Okay, so basically we are going to see the urine output. So basically for class 1, usually the urine output will be normal, usually more normal, about more than 30 milliliter. Usually they are normal. For class 2, usually they have slightly reduced urine output. For class 2, usually they also have for class 2, usually the urine output is not reduced. For class 3, usually they have reduced urine output. And then for class 4, usually they don't have any urine output, or we call it as anuria. Okay, alright. So basically, there are clinical features that we can see accordingly in the patients with hypovolemic shock. So basically, for class 1, usually they are normal. They look okay. They don't have any cold peripheries. They are not tachycardic. They are not tachypneic. They are okay and they look normal. For class 2, usually they have cold periphery. Usually they are tachycardic, tachypneic, but the urine output is normal. Alright, sometimes they can look a little bit anxious, but overall the urine output is not reduced. For third class, usually they look confused. They have cold peripheries. They have conjunctival pallor. The urine output is also reduced, and also they are tachycardic and tachypneic. For class 4, usually they look very lethargic, very confused. Sometimes they are in comatose state, and then they don't have of course they have the all cold peripheries, pallor, they are in tachycardic state, they are in tachypneic state, they are also in hypotensive state, and also the urine output is significantly reduced, or there won't be any urine produced, also called as anuria.